comes in, and I will if there's any questions, I will answer them. If you're not watching this live, if you're watching this after the fact, one of the things I will tell you is you can ask questions on the comment sections, and I will do what I can to answer them. The real important thing is to actually look at the whiteboard. Me, you'll notice I come in and out. I'm not really that important. Don't pay attention to the man behind the curtain, right? So what I'm going to talk about is fists and hand, pretty much a handle anatomy when it comes to striking. The reason is, if you notice, there's actually a lot of different ways people use their hands to strike. I will say that I do feel that one way is better than the other, especially if you're going bare-fisted. If you are using a lot of padding, it's not going to matter as much, although there have been boxers who have broken their hands doing things a certain way. Now, when you look at the hand, I'm first going to talk about the fingers, which we call the phalanxes. And if you watched the video on anatomy of the hands, you will notice that a lot of this may be a little bit of repetition. But one of the things we actually do is we do name everything. And when it comes to fingers, we actually name them based on the numbers. So thumb would be 1, 2, 3, 4, 5. So when they talk about the fifth digit, it would be the pinky. The first digit would be the thumb. Now, each finger is divided into different sections. If you look at the thumb, it's actually divided into two sections. You have the area out here, which is distal, farther away, and the area here, which is proximal. If you look at your other fingers, you'll notice that there are three divisions. So you have the distal, proximal, and the one in the middle is just called the middle. Now, if we were to look at the phalanxes, which are the bones of the fingers, we would see that they have a head, then a shaft, and a base. It looks something like this. Now, on the head, except for the first one, on the head, most of them will have cartilage on top of it. So in the middle and proximal, you'll have cartilage there. On all of them, you'll have cartilage on the bottom portion. Now, this is important because if you do a lot of trauma to the cartilage, so for instance, if you're actually using the one knuckle here, or even the metacarpals, which are the bones of the palm area of the hand, if you're actually doing a lot of contact with them, you can do damage to the cartilage, which will lead to something called osteoarthritis. If you know anyone who works with a lot of power tools, a lot of times they will actually have osteoarthritis just because of the vibration. So that is one of the big things to actually look at its fingers. Now, one of the things that's interesting with fingers, and I mentioned this in the last live video, is that the force that one of the phalanx can take is about 3 times more than steel of the same weight. So on an axial compression, these fingers can actually maintain can take a lot of pressure. The problem is if it goes at angles. Now, people break fingers all the time. Sometimes it's not a complete break, sometimes it's just partial. You can pull parts of bones off, called avulsion fractures. Happens all the time. Usually what they do is they tape them, but you don't want to rely on just taping them. If you think a finger is broken, you do want to have a doctor look at it because it may need surgery. So these are our fingers. And like I said, they break all the time. There's pretty much a lot of times people will think if it looks clinically like a break, treat it like a break. Now, when you get to the palm of the hand here, you have 5 what are called metacarpals. And again, they're labeled 1, 2, 3, 4, 5. And these metacarpals are the ones most people are usually dealing with when they're punching. If you think about this, there are some katas that use straight hands here, and the place that most likely would be breaking would be the fingers if they bend one way or another. If they're straight, you can actually maintain a lot of pressure. Like I said, it's about the same. Has the strength of steel of the same weight. Well, 3 times the force of steel of the same weight. So really, that's all we can really talk about fingers. When we deal with the metacarpals, there is actually a difference between the first one again and the others, and that's in the joint down here. Now, there is a couple other things. This first metacarpal has a tendency to break. A lot of times it's seen in sport injuries when the thumb gets pulled all the way back, and it breaks at the base. So this is if you think of the phalanges, the metacarpals have the same idea. You have the head, the shaft is here, and the base is here. I'll just put B for base. So In the thumb, you have actually an interesting, pretty much an interesting joint. It's called a saddle joint, and allows your thumb to move side to side and front and back. The other ones, the other metacarpals up here, will actually form condylar joints, which means that when you actually make a fist, you're actually hitting with this part up here. That's why, when people do makiwara, they actually have to be careful. Like I said, the metacarpal of the thumb can break pretty easy. They actually have calculated that of all the fractures of the hands, by the way, most hand fractures make up about 40% of all fractures. The metacarpal, the first metacarpal fracture, this is here at the base, is about 10% of all hand fractures. Now, the way they actually break is the thumb gets pulled back, like I said. So if you're one of the people who's boxing bare fist and you have your thumb here, you are actually causing, if you actually miss and hit with the thumb here, you can end up getting the break at the bases of the skull, of the thumb, and that is something that will need surgical repairs. Now, if you come here, what you'll notice is it's actually tucked in, and it tends to be a lot harder for the thumb to be pushed in to get the same effect. I have seen a lot of articles recently talking about how the human hand was made to punch. Truth is, you really need to learn how to use it as a tool for punching. So it is one of the big things that I tell people. Not really a great tool for punching, but if you need it, if you have it, you can use it. Now, the other fingers that actually tends to break a lot is actually this one here, which is the fifth metacarpal. It tends to break here on the side, and it's usually referred to as a boxer's fracture. Again, 10% of all hand fractures here. Another 10%, more than 10 usually, they say, is the fifth one here. And this one here is about 10% too. Now, the way those usually break, as the name implies, boxers, you hit with those three knuckles. These two tend to break. Now, again, if you think about professional boxers, they're wrapping their hand, they have them in glove. So these fractures don't happen as much as they used to, but they still tend to happen. If you actually look at some of the manuals, and I was looking at some HEMA websites and Facebook posts, and they actually were talking about how most the old bare fist boxing would tell people to use these two, the second and third metacarpal. And there's actually a lot of reasons. For one, they don't break in the same direction. Remember, if you take this 3 times, but if it's an angle and the bone bends a little, it's broken. And so that's actually your metacarpals here. Now, when you get to the wrist here, you get your carpals. Meta means next to, so these, the bones of the hand here are your metacarpals. The ones here in your wrist are your carpals. Now, I will talk about 2 other bones besides the carpals. I'm going to mention some of them. And that is, one is the radius, which is here. The other one's the ulna here. I always used to tell my students, if you remember Dr. Evil puts his finger out like that and say, follow the pinky to the ulna, the evil ulna. Thumb, when I was a kid, things were rad and you put your thumb up. So the radius, the bone here, is rad. I needed little goofy tricks to remember everything when I was in anatomy. A lot of you are a lot more intelligent than I am, so probably don't need them. So these are actually the main bones. Now, when we're punching, and we actually are coming out here, a lot of times people say, well, it's a preference. You punch wherever you want. Already we can see that some sides are better to avoid. Some of them tend not to break as often. And so it's actually better to get the fracture, pretty much to punch in a way that it fractures less often. By the way, the head of the metacarpals, tarsals, I'm thinking feet, usually can break, but it's the only numbers I was able to get was very rare. And if you're interested in getting the list of references that I use, let me know and I'll try to find them. I have them on my computer somewhere. So this is actually one of the big things. Now, why did I mention the radius and ulna when I'm actually only talking about the wrist today when it comes to punching? The reason is this. When we get to the wrist here, you have a couple different bones. Me, it's not that apparent, but if you actually take your thumb out here, there's a little divot right here, which is where the radius and the carpals come into play, and it's a bone called the scaphoid. Over the scaphoid, you have another, well, pretty much it's scaphoid here, and as you move a little to the side here, you have what's known as the trapezium, and then you have the trapezoid, And the reason I mentioned those bones is the carpal bones can also break. 70% of all fractures of the carpal bones, which is only about what is it? Can't even remember but carpal bones is 70% of all fractures of the carpal bones is a scaphoid, which is here. It's a relatively nice sized bone coming this way here. Like I said, it's here to here. And most of it is under the thumb. So again, if you're punching like this and your thumb gets pulled back, you can cause a fracture of the scaphoid. Usually scaphoid breaks by falling on an outstretched hand, by judo and a lot of other martial arts teach you to fall by tucking and doing other stuff. Now, the other bone that is actually important to know is coming way over here at the end. You have a little hook called it's called the hook of the hamate, and it's over here, and it helps pretty much maintain everything going into your hands in a plate. Now, I will tell you right now, your fingers don't have muscles in them. They have tendons, which are what muscles pull upon. The muscles for your fingers are actually in your forearm. So if you notice, when you make a fist, you'll notice that the muscles here actually clench. In your hand, you do have the thenar and hypothenar eminence, which actually do make up muscles for the thumb and pinky. And these actually can protect the bone a lot. But if the hamate breaks, which it does have a fracture about 2%. Remember, the fracture of the scaphoid is about 70–80% of all wrist fractures. So 2% of all wrist fractures is pretty big compared. It can break, and it's a fracture called it's actually called the driver's fracture. But I was able to find a couple articles. I didn't cite them because it just pretty much just told us about how they actually occurred, and it was people hitting something with an open hand strike using this part right here. The hook of the hamate broke off. Usually it breaks by, now it's golf, missing the ball, hitting the ground, and hitting here, but also baseball players have actually broken it. And so you have that. Now down here you also have the pisiform and the triquetrum. I'm not going to deal with that right now. But I do want to actually show you something with your wrist. Now, if you notice, where the radius and scaphoid come together, radius is this bone here, scaphoid the first bone here, it's pretty tight. If you go to the ulnar side, this is the ulna, remember? You'll notice that it's open. So what that means is any force here does not have the support, and so can actually cause a bend. And I was talking to a gentleman I know, I don't know if he wants me to mention him, but he actually mentioned that you can see a lot of sprains in the wrist when the ligaments of the wrist, when the wrist is actually forced to turn in this direction. So if you're using these three and your hand is not wrapped, it can end up causing problems with ligaments in the wrist. Remember, if you feel on your wrist, you'll notice that you have actually a nice soft spot between the ulna, which is a bone here, and the triquetrum and the pisiform over here. Now, the last thing I'm going to mention, and I know this is actually a pretty quick video, it seems, is there are certain structures on the hand, which are called the radial, the ulnar, and the support column of the hand. If you actually look at your radius here, and you notice that it comes down the side here, you'll notice that, well, that's actually called the radial column. And the radial column is pretty much made up of the scaphoid and a bit of the trapezium. And then it goes into the radius a little bit. It's really not the stable joint. So doing anything with this thumb, kind of not a good idea unless a placement is actually moved a little. On the ulnar side, you have the ulnar column, which, again, you actually have the hamate, the triquetrum, and then you have a space before you get into the ulna. And so that doesn't really allow for a lot of stability. It does actually give you a lot of mobility. So if you actually look at the way your wrist moves, most of the movements actually occur at the ulnar area. There is a third column, and if you take these two fingers and you follow them, you end up hitting a couple bones. The first one is a little bit of trapezium, but also it's called the trapezoid. Sorry, trapezium, the trapezoid is next to it. And then it goes to the last part, pretty much the ulnar portion of the scaphoid, and then it goes to the radius. And that's actually a relatively strong column, as they call it. In orthopedic surgery, for instance, they call that the support column of the hand. So when you're actually hitting, you have a choice. Do you want to use something where the bones break relatively common? You have a space and mobility, which can cause problems to the rest of the wrist. Do you want to put your thumb in an area where it can catch? Or do you want to use what orthopedic surgeons refer to as a support column of the hand? Now, with that, you can actually see that some things are preferred. Now, I will say this. I have noticed that a lot of martial arts that do use the 3 knuckles here to punch don't use that for the head. They actually use open hand techniques. Now, remember though, if you use open hand techniques, you actually can damage the hamate and the scaphoid, depending on which one you use. It is a lot harder than breaking some of the other bones, but it is possible. Now, if you think about it, we can use science, basic anatomy, clinical anatomy, to determine what's the best way to do anything. And I was actually going to draw the picture of the wrist. If anyone wants me to, I would have, but nobody's here anyways. Nobody's asking questions. So I guess I'll stop there. Now, next time I'm actually going to go into the radius, which is this one here, and the ulna, the humerus, clavicle, and scapula. And that should finish out the arm. The next time I do a live one will be, again, roughly the first Saturday of the month. So it'd be March. I don't know what day it is. I hope you enjoy this video, and we'll have a nice day.